Aloha, I am Hailey Guzman, and I will be speaking about how training coping skills can lead to a successful substance misuse recovery. So let's go ahead and get started. I'm going to hide myself just so that way you can see all of the information. Go, and let's get started. So before I dive deeper, I would like to add in this message that I've heard previously, um, that all coping mechanisms are proof of our resiliency. I would say that every day our strength is tested mentally, physically, and spiritually, and we find our ways to overcome the easiest and hardest of obstacles. The idea of moving forward will benefit the individuals in this intervention plan who need the right preparations for their battles. So, at the idea in the plan was created specifically for the Kalihi Uka Recovery House, also known as KER, which is a facility within the Institute for Human Resources, also known as IHS here on Oahu. This site is service for referred individuals who are currently homeless and suffering from substance abuse. A point I would like to emphasize is that with these individuals who come to KER, they are referred in from any IHS or outside source if there is space available for them, and that these individuals are strongly making the decision that they want treatment. However, the lack of being able to tolerate or withstand and stick to the treatment of recovery is taking precedence over where clients are unable to reach a successful recovery. By creating the ideas and plans as the one as I present to you today, we are helping a community that is making attempts to get better, but just need the extra support to get through their treatment. So at KER, it is one of the main facilities to include the Alcohol and Drug Abuse Division, also known as ADAD program, where extensive outpatient services are provided. With that being said, the course of action towards care is different for each client due to the widespread of traits that they possess, things like physical health, education, employment level, legal status, and family history. However, not a lot of information about their mental health or capability of withstanding treatment, or past treatment is there. Therefore, it is needed for an updated and new treatment. They are going to be learning and going to classes, but aren't focusing on breaking their old habits and avoiding triggers. Another part of the program is to get their treatment for clients and prepare them for transfer into affordable housing. However, with that lack of looking for coping skills, or just feeling ready, they do not have the social skills to be on their own and long term to go into affordable housing, to be on their own and to get back into what we classify as societal living or returning back to society. A quick note to point out before I start on this topic is that substance use and addiction can happen to anyone at any time in their life, and that these clients shouldn't be defined by their use. Each person has had their own story and their own growing up, and that we should leave it at that, essentially. And that these clients are looking to get help now. We may see users from all types of substances if they use periodically or daily and use one or two, more substances. The ADAD program may receive up to nearly 160 clients who are looking to improve their lifestyles through treatment. But if the individuals are not on the right path where they cannot find their motivation or have those foundations to increase their self-esteem, they are more likely to relapse. With the recovery process, it becomes crucial to eliminate the triggers and cravings with positive factors to distract the urge to use again. Developing coping skills will only boost their chances towards recovery and long-term sobriety, as well as improve their physical and mental health as well. It is noticeable from time to time to tell who has developed skills versus the people who are still struggling with being in basic recovery. By starting in the initial intake process to assess what coping skills personally work best, physically, emotionally, and spiritually, these components can be determined what the course of action will be to replace the triggers with positive skills. The plan would be to start working through different elements of each coping skill, monitor their progress, and hopefully prevent or predict future risks of relapse. Now, going more into depth about these coping skills, they can be distinguished between three versions: physical, emotional, and spiritual. each with a benefit towards improving a person's overall well-being. They help a person tolerate, minimize, and deal with stressful situations to essentially become resilient, just like I mentioned earlier. Through each coping skill, there will be different activities that the client can use to train themselves to establish a coping skill that will stick with them for the rest of their life. Some of these examples will include exercising, yoga, breathing control exercises, personal journaling, meditation, praying, and completing designated workbooks within their coping skills. From this concept and potential implementation, we can look forward to personal growth, reduce substance, improve treatments, and my favorite, Sustainable Development Goal, SDG number 3, good health and well-being within certain populations. With improved personal traits, lower risks of relapse, effective and efficient treatment, and an increase of successful recoveries, we are essentially rebuilding the outlook of substance misuse treatment. And ultimately, we may see a cleaner, happier, and healthier community that we can have for years to come. And then these are just my references that I used. And then thank you for listening. I hope you have a nice day.